Good evening, everybody, and welcome to our Facebook Live here at Breast Cancer Now. It's an absolute pleasure to have you with us this evening for our Q&A session. So my name's Vic. I'm one of the clinical nurse specialists here at Breast Cancer Now, and very shortly I'll be joined by my colleague Addie, who's also another clinical nurse specialist at Breast Cancer Now. So just a few housekeeping bits and pieces. We have had some questions in before the session, so we'll try and get through those as we can. But as the live goes through, if you have any questions that you'd like to ask me or Addie, then please put them in the chat and we will get to them as much as we can. We hopefully get through as many of them tonight, but if we don't, we will give you a written reply in the next few days. So do bear with us with that, but we will get to every question that you ask us. So please fire your questions. As always, there will be an evaluation form. So we're really keen to know what works well for you. If there's any topics that you'd like us to cover on our lives, or anything you think could do that a bit better, or you really enjoyed something, then please do give us your feedback. We gratefully receive it. If you have any issues that you want to talk through with our nursing team, our helpline is open Monday to Friday, 9 till 4, and on a Saturday, 9 till 1. And our helpline number is 0808 800 6000. So please do give our team a call. We're always happy to take your calls. If the line's busy or if you want to leave a message outside of those hours, then we do have a voicemail and one of the team will ring you back as soon as they possibly can. One other thing is that our next Facebook Live is next Thursday, same time, 7 o'clock. And that's with a lovely guy from Mummy's Star, Pete from Mummy's Star. So we'll be talking about breast cancer in pregnancy and a year after birth. So it'll be a pleasure to meet Pete then. And of course, any questions you've got, then please do send them ahead of time. So I think that's all the housekeeping done. So now it's my absolute pleasure to introduce Addie, who I'm sure you've all met before. But hi, Ad.
Hello, hi there.
Hi,
Hi,
Addie.
everyone.
Are you okay?
Yes, not too bad at all. You?
Yeah, all good. Thank you, Addie.
Oh, lovely.
So, Addie, we've had some questions in. So I wonder maybe you want to ask me a question as we start off.
Yes, absolutely. So we have had some very interesting questions. So, Vic, Han is asking, what is type 3 cancer? And I'm guessing she's possibly meaning grade 3. So what type is type
Yeah,
3?
it's difficult to say, Han. So if you're on the call with us, stage and grade is really quite confusing and people often get them sort of mixed up, I guess. So when we talk about cancer grades, grades of breast cancer, there are 3 grades, 1, 2 and 3. So grade 1 means that the breast cancer cell looks more like a breast cell, so it tends to grow a little bit slower. Conversely, grade 3, the breast cancer cells have more of their own identity and tend to grow a little bit quicker and tend to be a little bit more aggressive. Remember, we never take anything in isolation, so you wouldn't just think, oh, I've got a grade 3, it's really aggressive. There are many pieces of the jigsaw puzzle that help define what type of breast cancer you have overall. And grade 2 is in the middle of that. Now, when we talk about stage of breast cancer, we have stage 1, 2, 3, and 4. There is a staging terminology that they use in the breast cancer community. It's quite complicated, so do always ask your teams about what stage you might be if you've got questions about that. But a grade 1 breast cancer means that the breast cancer is confined to the breast. A stage 2 means that the breast cancer is obviously in the breast and some lymph nodes are affected, less than 3. A stage 3 breast cancer generally means, and there are all subgroups within there, that the breast cancer is probably larger than 5 centimetres and more than 3 lymph nodes are involved. And stage 4 breast cancer is what we know as secondary breast cancer or metastatic breast cancer. And that's where the cancer has spread outside of the breast and the lymph nodes. So, Han, I hope that's helped with your question. But if you do want to talk through what you mean by type 3, then please do ring our helpline and the team will be able to talk that through with you.
That's great.
Okay.
Thanks, Vic. That was good.
Now, Ads, let me ask you a question. So, Ads, Katie is asking, and this is a question we hear a lot about on our helpline and on our Ask Our Nurse service. So it sounds as though Katie's about to start chemotherapy, and she's asking, how can I prepare for my chemo to start? And Katie said she's worried about the side effects.
Yeah, so Katie, this, like you were saying, Vic, it's a very common problem that common question that we get asked, and it's also, I would challenge anyone that's had a breast cancer diagnosis and they're going to be having chemotherapy, not to at least be concerned about it, if not very highly anxious, because the potential side effects look very scary. There are quite a lot of potential side effects. So, but most people get some of them maybe mildly. Some people will get severe side effects, but it's unlikely you're going to get all of them really, severely. So, and I think the main side effects that we do get concerned about is infection, risk of infection, because so chemotherapy works on damaging cancer cells that are and any cells that are fast growing in the body, which is, unfortunately, it doesn't differentiate between good and bad cells, if you like. So any fast growing cells such as hair follicles, nails, skin mucus, lining of the gut and in the mouth. So, and which is why you get those side effects of, happening there. And I mean, of course, there are things that they can do about the side effects. And I think it's about, there's a few things you can do, Katie. We've got our web pages about chemotherapy and side effects, Breast Cancer Now. There are forums that you can either register for and put your questions in. And there's different threads. There's also monthly threads. So every month if you're starting your chemotherapy, say in March, then you can go onto the monthly threads and register for those. And it's a really good way of getting people together and chatting really online. We also have our Someone Like Me service, which we've got a fantastic group of volunteers that have had all sorts of different treatments, different age groups. We've got male partners of people with breast cancer. We've got men that have had breast cancer, because men get breast cancer too, less commonly than women. But we can put you in touch with somebody who's been in a very similar situation to yourself, Katie, and who's had chemotherapy and knows exactly where you're coming from and has come out of the other side. And I think it's really encouraging, isn't it, Vic, when we put people in touch with Someone Like Me volunteers. They're an absolute godsend. They really are fantastic. So
absolutely, they are. That peer support is
yeah,
brilliant. And like
essential.
you say, Addie, it can be really frightening when you start. And I can remember, being a nurse in practice and being in the chemotherapy consent appointments. And of course, the oncologists are obliged to tell you every possible side effect that you might get.
Yeah.
And it can be overwhelming, can't it? But like you say, no one should be taken to their sick bed during chemotherapy, and there are treatments that you can be given. So it is important, isn't it, that you speak to your treatment team?
Yeah, absolutely. And the chemo, usually the staff in the chemo suite are fantastic. They do this all the time, don't they? And they'll discuss about the risks of side effects and, what you could do to counteract them, so nausea is quite a common one as well. So that's about knowing that they will be giving you anti-sickness tablets and possibly some steroids and it's good to know what those effects are going to be, likely to be. The reason they give steroids with the anti-sickness tablets is it enhances the action of the anti-sickness, and so there are things that they can do to help. And like you say, you shouldn't be really, really sick. I think it's really important to be able to report those, because not
Absolutely.
every chemotherapy drug is, suits some people, doesn't it? But
Yeah. And you find that, don't you, Eddie? People get different side effects. Some people can sort of cope okay with it, and other people maybe have to be admitted for some of their side effects. So it's a
yeah,
huge range, isn't it?
it
But
is.
everyone should be given a 24-hour contact number, shouldn't they?
Yes,
And that's
yeah.
really important because it's so difficult to know what's normal and what's normal.
Yeah, exactly. Yes, so that's a really important contact. If you can't get hold of that person, hopefully, if it's within office hours, you can contact your breast care nurse. But yes, like we were saying earlier, please do give our helpline a ring if you want to talk about either being put forward to someone like me volunteer, or if you want to talk things through with one of our nurses as well.
Yeah.
That's really important. And I think so. I think the
Yeah, exactly. And
Yeah, I was just going to, coming on from that, we have had a question also from Jill. I worry about possible sepsis. So how do I deal with this worry? And again,
yeah.
that may be because she's having chemotherapy, or she's about to start chemotherapy maybe, and she's heard about sepsis. So just explain a little
And
bit
that,
of that.
that sort of ties in, doesn't it, with Katie's
Yeah.
question, one of the side effects. And I
Yes.
think sepsis is really one of the things that the oncology team worry most about. So it's understandable that you're worried, Jill, and we get that. So sepsis, maybe what it was called neutropenic sepsis. So it really means when your white blood cells are lowered as a result of the chemotherapy, and they're not, so your body may not be able to fight infection as it may have been able to do otherwise. So you will be asked by your treatment team to monitor your temperature on a daily basis. And they will want to know either through the oncology team in office hours, 9 to 5, or on the contact 24-hour contact number, if your temperature goes over 37.5 degrees C, or also if it's low under 36 degrees C, or it could be, whatever your treatment team has advised. But be aware that I think some people think, Addie, don't they, that with sepsis it's a high temperature, but they also
Yeah.
want to know about a low temperature.
Yes.
And the thing to
Always.
stress is that you're not going to bother anybody by ringing that
No.
telephone number. That is what it's there for. And they would much rather that you rang and spoke through any concerns than you left something and then it may potentially become more serious.
Yeah.
So,
Absolutely.
Jill, another thing to be aware of is if you suddenly feel unwell, even if you've got a normal temperature, it's important to contact your team, and that is straight away. And also, if you've got any symptoms of infection, such as a sore throat, maybe a cough, if you need to pass urine more frequently, or maybe if you feel cold or shivery. So it's really important. And I think the take home message really is to, if in doubt, contact your team. You
Yeah.
won't be a nuisance, but it's
Yeah.
really important that you do. And Jill, we get that it's a worrying time. So if you want to talk anything through with us, please do ring us on the helpline. But if you're symptomatic in any way with the things that I've spoken about, then don't delay and ring the 24-hour
Yeah.
helpline for that.
Absolutely. Yeah.
Yeah.
Um,
Okay then,
I think,
Ads, let's have a look. We've got another question in, and I'm just trying to find it here. So this is a question from Daphne. And Daphne's saying she's really struggling with sleeping at the moment.
mhm.
Daphne's saying her head is so full of worries. And Daphne's saying, does everyone feel like this?
Well, all we can say is that I'd say yes. And again, I challenge anyone that's had a breast cancer diagnosis not to at least feel really anxious, really concerned, if not, quite depressed sometimes, particularly when there's a lot of uncertainty and you don't know what you're dealing with, you may have not have started treatment. I don't know. We don't know how far along the way Daphne is with her treatment, but this is a really, really common, problem that people have and tell us about, and we actually, it's really important that that sort of gets sorted out as well. That their concerns are addressed. So I think again, it's about speaking to your team, and if it's about the treatment that you're having, it's about talking it through with them. And so that I think sometimes the lack of explanation can be quite worrying. And we actually on Tuesday night we did a very good Facebook Live with Dr. Mike Scanlon, who's a sleep expert. He's very good, and he uses a lot of sort of tricks and mindfulness to help people sleep, and he's got exercises that he does. So but that Facebook Live is actually on the Facebook pages at Breast Cancer Now, and it's also on YouTube as well. So it's honestly, definitely, it would be really well, and anyone else who's having sleep problems, really worth having a look at that. And in fact, it was so good that he did a little bit of a mindfulness exercise, and one lady said she actually fell asleep before the end and wanted to know if it was being recorded because it was so good, and I felt very relaxed at the end of it. So he's got a very good way about him, and there's also really good. He's got a web page called the Sleep Vet. And it's got all his sort of little tricks and his methods of being able to help people, because sleep is very different for different people, isn't it? So you might get to sleep very quickly, but actually you wake up in the middle of the night worrying, or you wake up really early in the morning. Some people might just not be able to get to sleep. So, but then they sleep in too late. And there are different reasons why, people do have sleep deprivation and disruption, isn't there, during treatment? Because, you might have given up work, for instance. So now you've got more time to rest in the daytime. So it's about sort of being sensible about having short naps. You might just be that you're not eating very well, for instance. It might be as simple as that, or you're dehydrated, and that can lead to sleep problems. But I think it's just about and it's just about doing things like keeping the room dark. So Mike was saying that if nothing else, if you don't remember anything else about how to help your sleep, never sleep with artificial light in the room when you're nodding off, and be away from your screens, which it sounds like common sense, but we all kind of do these things, don't we?
Yeah.
And it's just about taking yourself away from the television, from the screens, at, at least an hour before you go to bed. And he was saying about reducing, we all know about reducing caffeine and alcohol, and he's even talking about sort of doing it just after lunch, not to have any more or very little
As early as
caffeine.
that.
As
Right.
early as that, yeah. For people that are really struggling, I think it's probably quite a sensible, a sensible action, isn't it? But again, some people get up because they want to go to the toilet, so that would make sense, not to sort of be drinking too much, just have a drop of water, before you go to bed. But everyone's slightly different, and I know it's going to be different too, for everyone. But yeah, so we have our sleep disruption pages, and our sort of we have our tips as well on our Breast Cancer Now web web pages. But if you want to know any more about that, or anything else about sleep, again, do give us a call on the helpline.
And Addie, that's really timely, because Jo asked a question: how can I get a better night's sleep? She's on cycle 4 of her chemo, 2 more to go. I'm super tired often. Any advice would be great. And I think the tips that you've just explained would be really helpful for Jo. But I think it's also be timely to sort of talk about cancer-related fatigue, wouldn't it? And we
Yes,
know that
absolutely.
cancer-related fatigue is different from other types. So, that feeling of tiredness, and it's a prolonged fatigue, isn't it? So, Joe, I would really direct you to the pages that Addie's spoken about, and also Macmillan do a very good booklet on cancer-related fatigue that you might find useful to read. So I hope that helps, Joe.
Yeah, no, it's absolutely. And I think we've had a few more questions, haven't we? So Shirley says, this might sound silly. It's not silly at all, actually, but I feel guilty that my breast cancer isn't as bad as other people's. I just don't know how to stop these negative feelings. And this is something that surprisingly, and I think maybe because it affects a lot of women, that we get these feelings a lot from people, don't we, Vic? That they feel guilty because they've got for example, a small screen detected breast cancer that was found on their mammogram, and it's tiny. They've had the lump taken out. They've had some radiotherapy, and actually they've been sent on their way, or they've been given tablets to take.
Yeah,
But
yeah.
but I said there that feeling, of it doesn't matter whether you've had a really big operation, such as both breasts removed and reconstructive surgery, plus chemotherapy, radiotherapy, and tablet treatment, or whether you've had a lump and some radiotherapy, and you've got a nice, neat little scar that you're very happy with. The emotional roller coaster that is breast cancer can be just as significant, can't it, Vic?
Yeah, absolutely. And I would say to Shirley, you've still heard those words. You've got breast cancer.
Yeah.
And so be kind to yourself, and maybe give yourself the same kindness that you would give to other people. Um, Another word we often hear is lucky. I'm
Yes.
lucky that it wasn't as bad as some other people, and it's all that
Yeah.
demonstrates, doesn't it, Addie, the roller coaster of emotion that you might feel. But everyone has their own story in regards to breast cancer, and Shirley,
Yeah.
your story is your story. So do call us on the helpline, and we can talk it through a little bit more. But
Yeah.
guilt is not welcome. Not.
No, no, not at all. I mean, there is enough guilt, isn't there, when you have a breast cancer diagnosis, or is this something I've done or I haven't done?
Absolutely.
And
And
it's
what am
like,
I doing to
really,
other people?
absolutely,
It's
yeah,
all that. Yeah,
yeah.
it's,
So
it's a huge emotion, isn't it?
yeah, yeah. So
Yeah.
no, that's. I hope that's reassured her in some
Yeah, I
way that
hope
she can
so.
actually talk. Yeah, yeah.
Yeah.
Um,
Well, Addie, we've had a question in from Wendy, and Wendy says she has stage 4 secondary breast cancer. She was recently diagnosed in December, and she's almost through her first month cycle of targeted therapy treatment. But Wendy's really struggling with pain management, so any helpful links would be helpful. And pain can be pain can be difficult, can't it, to manage,
yeah.
Addie?
Yes, definitely. I think and again, it's very different for different people. Um, and have you established that it is the targeted treatment that's actually causing the pain? Um, when Wendy says she's got stage 4, that means it means that her cancer has left the breast, and it's actually it's gone elsewhere in the body. So we're not sure where that is, but if it's pain management, it may be that she has bone in one of her bones or some of her bones. But it's really important, I think, to talk through the level of pain, and whether Wendy, you're on regular pain relief, and whether that pain is waking you up at night, for instance, or if it's new and different. I think it's really important to establish with your team whether that everything's okay and that everything's stable with your disease, for instance, with your cancer. And again, you are going to get pain with this. So and just establish that it is a targeted therapy, possibly that's not helping, or to rule out something else anyway.
Yeah. Mm.
They can sometimes send you, if you maybe need your pain relief sorted out, and maybe need an alternative type of pain relief. There are complementary therapists that may help you. And again, it's really important to speak to your team to make sure that you haven't got active disease and you are able to have that, those complementary therapists. But that can be very effective for pain. And again, we've got some information on our website about complementary therapies. They can your team might be able to also refer you to a pain clinic. If there may be one within the hospital, and they can be very good at, well, basically sorting out your pain, because there are different methods of doing that. Is there
And
anything
Addie,
else you can
also,
think of? Yeah.
yeah, I was just
Yeah.
thinking, even though Wendy's just been diagnosed with her secondary breast cancer, so it's a new diagnosis, but actually sometimes the palliative care team can be very good, can't they, at help
Yes, that's
managing
right.
pain? And I think
Yeah.
some people think, oh my goodness, palliative care means end of life care, but the palliative care team is so much more than that, isn't it? And it's
Yes.
symptom control. And I
Yeah.
know when I was in practice, the palliative care team were brilliant
Yeah.
at sorting out issues like this. So,
Yeah.
Wendy, it might be worth talking to your team about that. And like Addie said, if the pain is in maybe your hip or something like that, we really don't know where it is, Wendy. Sometimes things like radiotherapy can be helpful, can't they? But it's really important to discuss it with your treatment team.
Absolutely.
And
And
I don't know,
yeah.
Ed, if you remember from your nursing, student nurse days, but that famous quote that pain is what the patient says it is, existing where the patient says it does. So,
Yeah.
Wendy,
That's
your
good.
pain is very real and it's very real for you. So,
Yeah.
again, with any other question, you're not being a nuisance, you're not wasting anyone's time. And this is part of your treatment plan to get your pain managed. So, please do
Yeah.
talk to your treatment team.
And we offer some services as well for people with secondary breast cancer. So we can put those links for those services on our web pages as well. So yeah.
Brilliant.
Okay. And I think, did you have a question for me about screening from somebody?
Yes,
It's
that
screening.
was
Yes.
from
Yeah.
Sarah sent a question earlier about screening. So Sarah is 45, Addie, and she's saying she has health anxiety. So she worries about breast cancer and she wants to know why she can't have a mammogram at the age of 45.
Oh, okay. Yes. So again, this is becoming a more common question, isn't it, that we get
Mm,
because I think younger women, with breast awareness and people being more aware of their bodies and their breast, we do get this question a lot, and the breast screening, the national breast screening program on the NHS, is open for anyone between the ages of 50 and 70. It's every 3 years, women will be invited. Everyone who's registered as a woman from at birth will be invited every 3 years via their GP practice to have a screening mammogram, which is an X-ray for anyone that doesn't know what that is. And the reason for that is that most breast cancers occur in the older age group, so women over the age of 50. And the older you get, the higher the risk of getting breast cancer. We don't know exactly why that is. We just know it's in general it's an age-related cancer, and the risks are being female, possibly having a very strong family history, but that's not always the way. So the reason why we want to sort of capture the 50 to 70 age range is that you have to target your audience, if you like, your demographic for for screening to a population where it's going to be a benefit. So the sooner that you pick up very early breast cancers and very early problems, the much more successful the outcome's likely to be. So, but if you are under the age of 50, it's really, really important to be breast aware. And I can't stress that enough. I spend my life as a breast awareness clinical nurse specialist, sort of showing people, demonstrating how to check, and just getting the message out that it's about breast awareness is about getting to know your body and your breasts by checking regularly all of the breast tissue up to the collarbone, into the armpit. Do it at different times in the month. A lot of women don't have regular periods or don't have a menstrual cycle at all. And then if you get to know what's normal for you, so somebody, so Sarah might have very nodular, lumpy breasts. That might be normal for her. But if you find anything new or different, or you're not sure, maybe an unusual nipple discharge, a hard sort of craggy lump, you need to report that to your GP and 9 times out of 10, it's not going to be breast cancer. So it's just really important before you get to the age of the screening process, Sarah, that everyone checks regularly, and if you're not sure or if you've got something new or different, you report it to the GP so that they can assess you whether you need to go to a breast clinic, in which case you will get all the relevant imaging. So that might be a mammogram, ultrasound. You might need none of those, but if there is something there, you at least you're being assessed properly. So that was a very long-winded answer, wasn't it? Yeah.
But the take-home message is, Addie, isn't it, about being breast aware?
Yes.
Yeah, absolutely. So I hope that helps, Sarah.
Yes.
Now, Addie, we've had a question in from, let me see who this question is, from Paula. And Paula's asking, can I have my Herceptin injection while I'm having radiotherapy? So we always say, don't we, Addie, that any clinical questions should really be discussed with your treatment team.
Yeah.
But there doesn't seem to be any particular reason why you couldn't have your
No.
Herceptin treatment while you're
No.
having radiotherapy. Some depending on how long you're having your Herceptin for and how long you're having your radiotherapy for.
Yeah.
But there's no real indication it's not detrimental to the radiotherapy to be given at the same time. Would you agree, Addie?
Yes, absolutely. And it's only your team would normally be discussing that, wouldn't they, before you have your
Yeah.
radiotherapy? So I guess the reason that maybe they haven't is because it's absolutely safe. But
Yes.
yeah, again, it's much better to, like you say, to just call on them and then
Yeah,
ask
absolutely.
that question to them, because we can't, it's a shame we can't advise because we don't know your individual situation, Paula. So that's the only caveat we have. We're very willing to give some information out, but yeah. So yeah,
Yeah.
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 I think there are a few other questions, aren't there? Let me just see. I was going to. Oh yes. So Vic Kelly asks, I didn't have a period going through chemo for a year. Then when it finished, my periods came back, but have stopped again. Why would they be messed up? Well,
Oh.
yeah,
So, Kelly, that's I guess that's chemotherapy and breast cancer treatment. It can do that to your periods. And Kelly, it's we don't know how old you are or how close in age you would be to a natural menopause, and the average age for a natural menopause is about 51. So the nearer you are to that age, it's more likely that you will be going through the menopause. It's very common for periods to stop during chemotherapy and for them to come back afterwards.
hmm
And they can be erratic, can't they, Addie,
yes,
after treatment?
absolutely,
And Kelly, it
yeah,
depends maybe if you're on any other tablets such as tamoxifen or something like that.
yes,
Um, Periods will be periods, they can come and go. What your oncology team, your breast cancer team are probably more worried about is if you have any spotting.
mm,
So that's sort of, a spotting is sort of much less than a period. It's not consistent. It's just a little bit of bleeding. So it's always best to report that. But Kelly, again, it's always best to talk to your treatment team because, of course, Addie and I haven't got your clinical notes here, so we don't know what medication
yes,
you're on and everything. But certainly, Kelly, in answer to your questions, periods can stop. They can come back and they can stop again. So,
yeah.
but do talk to your treatment team about that.
That's great. Yeah. I think you had a question
Oh, yes.
about lymphedema.
Addie, Sarah's asking, she's on exemestane,
Mm.
obviously, which is daily, and she's on abemaciclib twice daily and 3 monthly hormone block injections, which I'm guessing is ovarian suppression. So
Yeah.
Sarah's asking, do all these cause hot flushes?
Of course they can. So exemestane is a what they call an aromatase inhibitor.
Yeah.
So which would usually be given to somebody who is post-menopausal, so after the menopause. But because uh, they they switch off the hormones the estrogen that may be making cancer grow, or need to feed off it to grow. You're going to get it, whatever age you are, you may well get the hot flushes because of that, causing that, and it's all to do with menopausal symptoms because you want to take that estrogen away. And of course, when you're, again, I don't know how old Sarah is, but when you're postmenopausal, your ovaries produce very little in the way of estrogen. It's usually derives from the fat in your body, and other organs as well, like your spleen, adrenal glands. So your circulating estrogen is being affected by that with these tablets, and actually, it's possibly that's going to be the cause of the hot flushes, unfortunately. But there are things, things that people can do to counteract those hot flushes. And again, it's about discussing it with your treatment team because some people like to use complementary therapies again, but or supplements, but actually, they need to be discussed with your treatment team because supplements can't be sort of scientifically researched, and actually, some of them do contain estrogens, which we don't want. So, but there are sort of simple things that can be done to counteract the hot flushes. But yeah, speak to your again, Vic. I think it's about speaking to her treatment team to see if there's anything they can help with.
Absolutely. And we have got, obviously, like you say, Addie, our pages on menopausal symptoms, our health information packages on there, which will give you some hot tips
Yeah,
about that. And also sometimes, Addie, ladies are referred to menopause clinics, aren't they?
yeah,
You know, if the
that's
symptoms are
right. Yeah,
really bad. So again, I think it's like our previous pain question. You know, it's not silly to ask about these things. It's really important that you do talk to your treatment team, because what we know is that some of these treatments, the side effects, can really affect your quality of life. And
absolutely.
that's really important that that's addressed. So, and if you want to talk anything through, then do ring us on the helpline, and we can guide you as best we can.
Yeah, no, that's good.
Yeah.
I think somebody was asking about lymphedema. Is that right?
Oh yes, that was Susan. So Susan says she had axillary node clearance 3 years ago, but she's noticed a swelling in her arm. Her fingers just seem to be a little bit more swollen than the other hand. So she's worried that might be lymphedema.
Yeah. So, Susan, that yes, it may well be. And lymphedema is a swelling in the tissues under the skin, and it's due to a blockage or a deficit there. So, by the lymph nodes being removed, it can increase your risk of a swelling called lymphedema, which it sounds like it may have started for you, Susan. And unfortunately, lymphedema is a chronic condition where it can be treated. So there's the sooner you address that and go and see your GP, your treatment team about it, the sooner the treatment starts, the better. The outcome, and they can help to keep it at bay. It's actually quite difficult to know sometimes whether it is lymphedema because sometimes all you get is a sort of a numbness, and where it hasn't been numb before in the arm, hand. It can happen in the breast as well. And the lymphedema has two major main roles. So one of its roles is to shift sort of toxins out the system, really. And lymph nodes, it's a bit like a plumbing system, really. So the lymph vessels have a string of, and they have lymph nodes at every junction, a bit like a train station, and they sift out those nodes, sift out all the rubbish that you don't need from your body, and sort of protect against infection. So that when you get, I don't know, when you get a really sore throat, you have a lot of lymph nodes attached to each organ in your body. Most of them are in your neck, which is why you get sore throat and you get lumps in your neck, because that's your body fighting against this infection, or your lymph system. That's very clever. But unfortunately, it recognises that if you have lymph nodes removed from any of that chain of lymph nodes, then you can get a swelling called lymphedema. And with the sort of modern surgery, lymphedema isn't, we don't get reported the same severity as we used to, do we, Vic? And I think,
Absolutely.
so hopefully, if this is a mild swelling and say you notice your rings are getting tighter, or your sleeves are getting tighter, then absolutely go to your treatment team. And unfortunately, in this country, we do have a problem with, it's very sporadic, the lymphedema services, but what you really need is an assessment by either a specialist physio who absolutely knows about lymphedema, or is a breast cancer physio. So that hopefully might be at your local hospital. Or if you're lucky enough, you might have a lymphedema service that have lymphedema specialists who can assess you again and see what you need. You might just need a bit of massage, which means that physiotherapists might be good to do that. But you might need a sleeve. So some people do need a sleeve. And we always get asked, can I just buy one, or can I just go and get one? It's really, really important, if you have got lymphedema, that you get measured properly and assessed for the treatment you have, because you can do more damage than good. But in the meantime, Susan, keep your arm and keep your hand and arm moisturized, washed, dried, moisturized, because again, if you have got lymphedema, because of the sort of toxins might be under the skin in that fluid, you are more susceptible to sort of a growing bacteria there and an infection. So, breakages in the skin, etc. So it's really important to look after your skin. But again, we've got a wealth of information on lymphedema. And we have the Lymphedema Support Network, which is a really lovely charity, small charity. And they have a helpline, so we can put their details up on our screen as well.
Yeah, and I think it's important, Addie, isn't it, to say, because you use the word massage, but massage for lymphedema is very different, isn't it, from a
Yes,
massage you may
it
have for
is.
maybe a sports injury or something like that. So it's really
Absolutely.
important to seek advice, isn't it, about that?
Yes,
Yeah.
yes. And sometimes they can teach they used to call it simple lymphedema massage, but they call it self lymphedema massage. So, which speaks for itself, really. But
Yeah.
the physio can show you, or the lymphedema specialist can show you, like you
Yeah.
say, the proper techniques. Because again, you can do more harm, or make the swelling more severe if you don't
Absolutely.
do it correctly. So, like you
Yeah,
said,
yeah.
Vic.
No, thanks for that, Ad.
Yeah.
And Addie, we've had a question in from Julie, and this is a question that we get asked quite a lot on our Ask Our Nurse service and on the helpline as well. And Julie is coming to the end of her 5 years of treatment, her letrozole treatment. And I'm reading from Julie's question that's making her more vulnerable, making her feel vulnerable to the cancer returning. And we, that is something, isn't it? Sometimes when people are on tablets, it almost feels like a safety blanket, doesn't it?
Absolutely,
That you
yeah.
have those tablets. And we hear from many women saying, well, can't I stay on them a bit longer, or do I really have to stop them? Because there's a sort of like a security
Yeah.
of taking those tablets, isn't it? But we know actually it's not always the best to continue them, is it?
No, that's right. I mean, if you've taken them for, say, 5 years or whatever you've been prescribed them as, you'll have had that benefit from them. Sort of research, and I kind of often liken it, but it sounds a bit glib, but I often liken it to, so you wouldn't carry on taking paracetamol if you hadn't got a headache, for instance.
Right,
You don't,
that's
and
good. Yeah,
yes, I mean that sort of risk of the side effects, and you can get more problems if you're taking, especially something like letrozole. It's not just a paracetamol, is it? So, they have their list of side effects, and they can be more severe and probably cause you more problems in the long run,
yeah,
if
that's
you
true.
if you carry on taking them.
And I
So
think some people, Eddie, get confused, don't they? And again, this is about the question we had previously about individualized treatment. So some
yes,
people may be prescribed letrozole for 10 years or other medication for 10 years, others 5 years. But we know that when you stop taking your medicine, there's a carryover effect, isn't it? So
yes, that's
actually the
right.
effect of the tablets do keep working for a number
Yeah,
of years. So, but like Addie says, it's, some of the side effects, as many of you will know, are really, quite significant.
yeah,
So what they don't want is the time frame that you have your tablets is discussed by the multidisciplinary team, and it's there are guidelines as to how long you should be taking it. So I
yeah,
understand, Julie, that it can be a vulnerable time, but we say the carryover effect, your medication will still, the effects of it will still be working for quite some time. And we don't want you to get, or your treatment team certainly don't want you to get any of the unwanted side effects from that. But
no,
I think that would be a really good thing to ring us on the helpline with, maybe where we've got more time to talk through your circumstances, Julie. So,
yeah.
do give us a call on the helpline when it's convenient for you, and we can talk it through in more detail.
Lovely. And I think, have we got time for? Well, I think we're nearly at the end of the
Nearly at the end. Do you
time,
have
aren't
one more
we?
question?
Yes, I'll ask Vic. Samantha asks, one of my hips has become very painful after my chemotherapy and radiotherapies. I've also had 1 out of 6 Zometa infusions. Is this a common side effect? And yes, so would you explain what Zometa is? And
Yes,
it,
so Zometa is often it's a bisphosphonate type treatment, so it can protect the bones. So again, Samantha, it's very difficult to know what your circumstances are. So you've had chemotherapy and radiotherapies, and so you're on bisphosphonates treatment. So it can cause bony pain, but I would always say to get it checked out with your treatment team. Um, I feel, Samantha, we haven't really got enough information here to be able to say what type of pain it is and how long you've had it. So that would be a good reason to talk to your treatment team, just so that they can do a full assessment of the pain that you're having.
yes, yeah,
We know that you can get aches and pains in your joints. After chemotherapy, radiotherapies, not so much on your hip unless you've had radiotherapy there. So it's just a bit difficult to say, Samantha. So
it
do
is.
talk to your treatment team, or again, ring us on the helpline, sort of with more information about the specifics of your circumstances, and we'll be able to help you out with that. So sorry, Samantha, I have been very vague with answering your question, but I think it's better to be that way rather than tell you something that's not quite right. So
Yeah, no, absolutely.
yeah. So Addie, I think that's it for now. We're out of time. But thank you for being with me tonight. It's been lovely to be together
Pleasure.
and answering some questions. I
Yeah,
realise we will have some questions that we haven't got round to answering, so I will do my best to answer those tomorrow
yeah,
or maybe early next week. But we will get them to you as best we can. So I hope you've enjoyed tonight. Please do ring our helpline. 0808 800 6000, and it's always a pleasure to help you wherever we can. We're here to support you. Okay, so have a good rest of the evening, everyone, and we'll see you again soon. Bye
good
for now.
night. Good
Bye.
night.